Thank you to everyone for joining us for the Movers and Shakers of Fresno. Jelena is a registered dietitian specializing in providing nutrition therapy for individuals with Parkinson's disease. Her path into the specialized field of nutrition for PD began when her father was diagnosed, marking the beginning of her role as primary caregiver. Jelena has developed nutrition interventions targeted at addressing key PD complications such as constipation, fatigue, sleep issues, brain fog, anxiety, and other related symptoms. Her specialized approach empowers individuals with Parkinson's to experience meaningful improvements in their overall health and quality of life. And with that, I will go ahead and let you take over.
Okay, thank you for that introduction. So I will go ahead and share my screen to share my presentation. And if you guys could just let me know if you see everything. Let me see.
Yeah, looks good.
Okay, great. Okay, so nutrition and Parkinson's, managing symptoms and optimizing health recommendations from a registered dietitian. Here's some of the topics that we're going to discuss in today's talk. I'll talk about a dietitian's role in the Parkinson's care team, the top foods to start eating for Parkinson's disease, how to manage levodopa or Sinemet with meal intakes, and how to prevent and alleviate constipation. So Jessica already did a good job of introducing myself, but I'll just kind of give you guys a little bit of background on my credentials and expertise. So I'm a registered dietitian nutritionist. I have my master's in nutritional science from Cal State Long Beach, where I did graduate research on the therapeutic role of nutrition in managing Parkinson's disease. I also have my bachelor's in nutritional science from Cal State Long Beach. And in my current career, I provide private one-on-one counseling for individuals with Parkinson's disease and their caregivers. And I'm also a clinical dietitian, so I see patients who are hospitalized. A little bit about my story. So when I was in college, my father was diagnosed with Parkinson's disease, which marked the onset of my role as his primary caregiver. Soon after his diagnosis, he started to experience new challenges. Some of the things that changed for him were his sleep cycle was totally different. He had trouble falling asleep. He started experiencing pretty chronic constipation that impacted his life. He had a lot of fatigue, low energy levels, weakness, and as you can imagine, these symptoms greatly impacted his overall well-being and quality of life. And it was pretty difficult to see my dad living in pain. So I felt very determined to try to use my expertise in nutrition to try to take him out of pain and see if we could alleviate some of the symptoms that he was experiencing. So we started doing things like changing his diet, incorporating different vitamins and supplements, being mindful about the time that he took his medication around meals, focused on lifestyle changes like stress reduction and improving sleep quality. And we noticed a remarkable difference in the way that he was feeling, his energy levels, his digestive health. He wasn't as constipated. He was sleeping throughout the night, and feeling more energized throughout the day. So now we'll get into a dietitian's role in the Parkinson's care team. And I really like to share these complications that nutrition plays a role in improving or managing. I think that a lot of the times, at least in my experience with my father and my experience with working with clients with Parkinson's disease, they end up experiencing new symptoms and not really getting solutions for those symptoms. They kind of just get sent home on Sinemet, and they're told that the complications that they're experiencing are just symptoms of their Parkinson's disease, and they just have to take their medication, and there's not much else they can do about it. So I just wanted to share with you guys some of the complications that nutrition can play a role in improving and managing. And those include things like constipation, gas, bloating, unintentional weight loss, fatigue, low energy levels, trouble sleeping, stress, anxiety, brain fog, restless leg syndrome, muscle pain, cramping, mood disturbances, medication effectiveness, and other comorbidities. So sometimes people don't just have Parkinson's, but they might have diabetes, kidney disease, heart disease, and so on. And also swallowing difficulties. So I wanted to touch on this point. Dietitians can help accommodate to the nutrition needs of people with swallowing difficulties, but it's actually speech therapists who help to diagnose swallowing difficulties. And since this really isn't my scope of practice, but I wanted to highlight the significance of it, I just wanted to make the point that if you are experiencing choking with eating or feeling like it's difficult to swallow, then you'd want to be seen by a speech therapist who can do something called a swallowing evaluation and help identify any chewing or swallowing difficulties that you may be experiencing and put you on the right diet texture. Once you're on the right diet texture, or diet texture and liquid consistency, a registered dietitian can then come in and help you figure out the types of foods that you can eat on that specific diet. So a registered dietitian helps with things like correcting nutrient deficiencies and imbalances. So if you get lab work done and your cholesterol is high, or your vitamin D levels are low, or you're pre-diabetic, correcting those imbalances is something that a dietitian can help you with. Adhering to a therapeutic diet. So if you need to be on a texture modified diet, or a specialized diet for heart disease or diabetes or any other condition, a dietitian can help you with adhering to that diet. We can help you with sustainable weight management, developing nutrition goals, assistance with food preferences and allergies, providing guidance on meal planning and grocery shopping, creating personalized meal plans and recipes, providing nutrition education and counseling, addressing barriers to healthy eating, managing drug nutrient interactions between medications and food, and also coordinating care with other members of your healthcare team. So to get the best care, you should have coordination between different members of the healthcare team, meaning that you're working with a doctor, a registered dietitian, a speech therapist, a physical therapist, and they're all coordinating care with each other to make sure that you're receiving the best help and treatment. And so, in order to demonstrate the role that a dietitian can play in the Parkinson's care team, I thought it would be a really good idea to present a case study with you guys with a real life patient of mine. So, AD is a 67-year-old male who was diagnosed with Parkinson's disease 4 years ago. He has a history of high blood pressure, high cholesterol, and prediabetes. He takes levodopa for his Parkinson's disease and statins for his high blood pressure. AP thinks he eats a pretty balanced diet and he stays active by working out regularly. AD presented with complaints of chronic fatigue. He reports feeling sluggish, having brain fog, muscle weakness, and despite taking his medication regularly, exercising, and trying to eat healthy, he hasn't found a solution for his fatigue. He's talked to other providers about the way he's feeling, but he was told that his symptoms were a part of his Parkinson's disease. So AD came to me pretty helpless about his fatigue. It was something that was kind of taking over his life. He was trying really hard to lead a healthy, normal lifestyle, but the fatigue was really taking over the way he felt and making it difficult for him to exercise some days, to do work around the house, and really just interfering with all aspects of his life, even socializing and the time spent with his wife. So during a nutrition assessment, some of the things that a dietitian will look at are things like your medical history, the medications you're taking, vitamins and supplements that you're taking, lab work, a 3-day food diary where you basically write down everything that you eat and drink for 3 days, your food preferences, food and fluid intakes, digestive health, sleep quality, stress levels, and nutrition goals. So these are all things that are discussed during the assessment with the patient to really take a deep dive into their health history and uncover some things that might be contributing to the problems that a patient like AD is experiencing. So during the assessment with AD, some of the things that I discovered was that he was taking his levodopa around the same time as high protein meal intakes, which we're going to talk later on about in one of our topics. So I'll help explain that to you guys a little bit more. He was also taking medications that had the side effect of depleting nutrients. He was taking a lot of unnecessary supplements that weren't effective. So he had a long list of supplements that some of them really weren't necessary. Some of them weren't really high quality supplements. So we also checked nutrient deficiencies on his blood work and found that there were a lot of levels that were low. He wasn't really eating a balanced diet, even though he thought he was, and he wasn't eating enough fiber and antioxidants, which is also something that we'll talk about later on. He wasn't drinking enough fluids, and his sleep quality was pretty poor. Initially, he reported that he sleeps pretty good, but during the assessment, we found out that he was waking up several times in the middle of the night, and that's not necessarily good sleep quality. So how we intervened with AD is first, we developed a schedule for taking levodopa around meal times. We'll talk about this later, but one really effective strategy at managing levodopa around meal times is to actually have a schedule in place and not have it be random. We added in foods and supplements to help replenish nutrient deficiencies, which were caused by long-term medication use. So although medications are great and have wonderful benefits, if there's a medication that you're taking long-term, you really do want to look into the side effects and how they affect your nutrition, because oftentimes certain medications, a side effect may be that they deplete a certain nutrient, and the way that you're feeling, if it's sluggish or fatigued or having trouble sleeping, could be the result of a nutrient deficiency. So it's just kind of taking like a deeper look at what might be causing a symptom, because a lot of the times it's something that's overlooked are the side effects of medications that you're taking. We switched to high quality effective vitamin supplements. So he was no longer taking unnecessary vitamins, and we put him on high quality vitamins that were relevant to what he needed. We improved his hydration with adequate fluid intakes. This is one that almost everybody thinks they're drinking enough fluids, but I feel like 9 times out of 10, people are not drinking enough water. And once they actually start tracking their fluid intake and they see the difference of how they feel when they're adequately hydrated, it's like night and day. We incorporated more fiber and antioxidants into the diet, which I have some tips for you later on in other slides how to do that. We had him following a balanced diet with adequate nutrient intakes, and he started to make healthier choices when he was dining out. And as a result of these interventions, AD noticed that his levodopa was more effective at controlling his Parkinson's symptoms, and he was experiencing less off times with his medication. So the term off times with levodopa is basically the time in between the last dose you took and the next dose you're going to take. Your off time is that time in between where you feel like the medication is starting to wear off and your Parkinson's symptoms are more active. So he was experiencing less of those off times once he found a regulated pattern with taking the levodopa around meal times. A few weeks after switching to higher quality supplements, he started to notice improvements in his energy levels and felt less fatigued throughout the day. And that was just as a result of correcting those nutrient deficiencies that he had. He was drinking more fluids and noticed a difference of being adequately hydrated. After incorporating more fiber into his diet, he started having regular bowel movements. So I would say, in addition to people thinking that they're drinking enough fluid, a lot of the times people are thinking that they're eating enough fiber. When once we kind of look at the diet a little bit more in depth, oftentimes people are not eating enough fiber, and that's just the general American population is not eating enough fiber, which we'll talk about. After weeks of eating a more balanced diet, he no longer experienced brain fog and he felt more energized during his workouts. As a result, his sleep quality improved and he noticed he wasn't getting up as often in the middle of the night. So these are just some of, this is just AD is a really good example of how taking a really deep dive look at what was causing his fatigue and coming up with the right interventions totally transformed the way that he was feeling and his quality of life. So now we'll talk about, well, these are my top foods for Parkinson's. This is kind of a little bit related to the research that I did when I was in graduate school and what I feel to be foods that you should eat every day for Parkinson's disease. Okay, so antioxidants. I like to give a little bit of definitions for this term because even just explaining antioxidants can be a little bit confusing. So fruits and vegetables have vitamins and minerals, but they also have compounds called antioxidants. You may have heard certain foods be coined the term superfoods like berries or dark chocolate, green tea, salmon. The reason they're called superfoods is because they have a high amount of these antioxidant compounds in them. So antioxidants are compounds that are found in a variety of plant-based whole foods, and they fight free radicals in your body. So free radicals are compounds that are capable of damaging your body's cells, including your body's nerve cells, which you want to protect in Parkinson's, right? Because Parkinson's disease is characterized by cell death, specifically the nerve cells that produce the neurotransmitter dopamine. So you want to eat nutrients that are known to protect your body's cells in the hopes that it's protecting your body's nerve cells from further damage caused by Parkinson's disease. An excessive chronic amount of free radicals in the body causes a condition called oxidative stress. So you may have heard that term before, oxidative stress. Essentially what that is it's an excessive chronic amount of free radicals in your body. So what antioxidants do is they help mitigate free radicals and reduce oxidative stress in your body. And antioxidants are found in a variety of fruits, vegetables, whole grains, nuts, seeds, legumes, herbs, spices, dark chocolate, tea. Examples of antioxidants, there's several, but some of the main ones are vitamin C, vitamin E, carotenoids, selenium, zinc. So carotenoids are one of the main antioxidants in carrots, and that's what gives carrots that very pigmented orange color. But pretty much all fruits and vegetables have antioxidants. Some have higher amounts of antioxidants than others. Some have different antioxidants. For example, a certain fruit might have high levels of vitamin C. Another one might have high levels of vitamin E, but essentially all fruits and vegetables have antioxidants in them. Here's some examples of foods that contain antioxidants. So my favorite is dark chocolate. Any excuse to eat chocolate, I'm giving you a really good one right now. It's just important that it's 70% dark chocolate or greater. That's the one with the high antioxidant content. So when you're looking for it at the store, on the package, it'll say 70% dark chocolate, or it'll be higher, like 80%. So you can say that a dietitian recommended that you eat more chocolate. Certain spices have antioxidants, so cinnamon, ginger, turmeric. So when you're cooking, just add more of these spices to your meals, like add cinnamon to oatmeal or baked goods, add ginger to different recipes and turmeric to different recipes. Cruciferous vegetables are a really good source of antioxidants. Cruciferous vegetables, like what's pictured here, are things like broccoli, cauliflower, Brussels sprouts, kale. Beans are another source, berries. So adding berries to your oatmeal in the morning, your cereal, adding them to a yogurt parfait or baked goods. Just kind of think about the meals you're already eating and how you can add more of these antioxidants in. And then sipping on green tea throughout the day. But maybe don't sip on it too late at night since it has caffeine, it might keep you up. And here's some tips to increase antioxidant intake. And I'll share my slides with Jessica. That way she can share this with you guys. And you don't have to feel like you have to write it down. You'll have this as a resource. But so some of the tips, kind of like I said, add berries to cereal, oatmeal, yogurt, baked goods, snack on fresh fruit, add different spices to your meals, drink green tea, matcha tea, black tea. And when you drink those teas, that's also contributing to your daily fluid intake. So you don't have to just drink water all day. Herbal teas actually also hydrate you and contribute to your fluid intake. Eating dark chocolate, adding beans to salads, soups, bowls, burritos, roasting cruciferous vegetables. So I always say, like, to eat more vegetables, make them in a tasty way that's going to make them more, desirable to eat. And I think one way of doing that is roasting them. And then making a snack plate with dried fruit, nuts, and dark chocolate. That would be like a very antioxidant rich snack. So the second type of nutrient that I think is very important for Parkinson's disease are omega-3 fatty acids. And you might have heard omega-3s before, kind of used interchangeably with fish oil. And that's because fish oil is high in omega-3s. So why omega-3s are important is inflammation, which is a natural essential process that helps the body fight infection and heal injuries. It's a natural thing that happens. We all have inflammation in our body. However, chronic inflammation can contribute to disease and cause damage to cells, including nerve cells. So just like how in my previous slide about antioxidants, I explained how oxidative stress can damage nerve cells. Well, so can chronic inflammation. So just how antioxidants help reduce oxidative stress, omega-3 fatty acids help reduce inflammation. And why this is so important for Parkinson's disease is studies have demonstrated higher levels of brain inflammation in people with Parkinson's disease than people without Parkinson's disease. So you kind of want to just take that and take that into consideration that reducing inflammation should be something that's a priority in managing your Parkinson's disease. And how you can do that is by eating more omega-3 essential fatty acids because they act as anti-inflammatory agents, meaning that they reduce inflammation in your body. One type of omega-3 fatty acid is DHA. It's actually this really long word that I can't pronounce and can't think of off the top of my head, but it's abbreviated DHA. And it's the dominant omega-3 in the brain. So in our brain, we have fat, and DHA is the dominant omega-3 fatty acid in our brain. And it actually impacts neurotransmitters and brain function. So omega-3s are really essential for fetal development and infant nervous system development. But similarly for us, they're really important for our brain health. So some of the food sources of omega-3 fatty acids, a lot of it is seafood, especially cold water fatty fish. So salmon, sardines, herring, trout, cod, oysters. Those are examples of seafoods that are really high in omega-3s. Nuts and seeds like flax seeds, chia seeds, pumpkin seeds, walnuts, pasture raised or omega-3 enriched eggs. So you can actually see when you go shopping for eggs at the store, on the actual carton, it might say pasture raised. Those chickens are fed a different diet, which makes their eggs higher in omega-3. Or it might say omega-3 enriched eggs, meaning that they enriched the diet of those chickens to have more omega-3s. And if you don't like eating fish or seafood, you can also take omega-3 supplements like fish oil, krill oil, or cod liver oil. And if you're vegan or plant-based, algae oil is a good source of omega-3 for supplements. And here's some tips on how you can increase your intake of omega-3s. So eating fatty fish twice a week. I really like sardines. I don't think everybody does. It seems like it's one of those foods that you love or hate, but I will get like a can of the skinless, boneless sardines in olive oil. They have it at Trader Joe's, and I'll have that with like crackers or bread. And I just find it to be such a satisfying snack, and it's really high in omega-3s. Adding flax seeds to smoothies, oatmeal, and yogurt, adding chia seeds to smoothies or making chia seed pudding, adding walnuts to cereal, oatmeal, yogurt parfaits, baked goods, choosing pasture-raised or omega-3 enriched eggs, and considering omega-3 supplements if you don't like to eat fish. And here's a recipe. Again, I'll provide Jessica with the slides so you guys have this recipe. It's a chia flaxseed pudding, which I make this all the time because I have a sweet tooth, just like how I mentioned with the chocolate. Any way that I can like fit something sweet and nutritious into my diet, I find a way. And this chia seed pudding can be a dessert, but it can also be like a breakfast, just depending on the toppings that you want to include with it. But this is a really good recipe that's not only rich in omega-3s, but really high in fiber, so it'll help with your digestive health. And now we'll talk about how to manage levodopa, which is also known as Sinemet, with meal intakes. So some of you may have heard this before, you may have not. It kind of varies. I talk to people who have been told about the interaction between their medication and their diet, and I've talked to people who have had no clue that there's an interaction between levodopa and Sinemet and their diet. So I'm happy to kind of help break that down and explain it to you guys. The medication levodopa, also known as Sinemet, which is the main drug for Parkinson's disease. It's a protein building block, and it competes for absorption with other proteins. So essentially, in simple terms, The area within your gut where levodopa is absorbed, it's absorbed through the same pathways as proteins. And so those two things, the proteins are the protein building blocks in the levodopa and the protein in the food that you eat. They're absorbed through the same pathways, and it's believed that they compete for absorption. So essentially, because they compete for absorption, taking levodopa with high protein meals may reduce how much of the drug gets absorbed and how well the dosage works. So it's not to say that the medication won't get absorbed at all or that it won't work. It's just to say that it might not get absorbed as well if it's taken with protein, and if it's not absorbed as well, that dosage might not be as effective at controlling your symptoms. Examples of proteins are things like meat, fish, eggs, tofu, nuts, beans and legumes, protein powder, and protein bars. So how you can kind of manage addressing this drug nutrient interaction to get the optimal absorption out of your levodopa cinemet and coordinating it with meal times is to take your levodopa on an empty stomach 30 minutes before or 60 minutes after a meal. And I really like to stress this point that you don't have to do this every time. Sometimes it's not practical. If you're hungry, you have to eat, or if you're on the go, you have to take your medication, right? When your symptoms start wearing off and it's time for your next dosage. Don't feel like you're bound by this recommendation, but it is something that you want to keep in mind to try to strive for to get the best absorption from your medication. And the reason I make that point is sometimes people just have a really challenging time taking their medication either 30 minutes before or 60 minutes after their meals for various reasons. Some people take several doses of Cinemet throughout the day, which makes it really hard to follow this timeline. So just do your best and do what works for you. If you can't take it on an empty stomach because maybe you get nauseous or it upsets your stomach, you can actually take it with a carbohydrate because remember, the drug interferes with protein. It doesn't interfere with carbohydrates. So I gave you examples of what proteins are. Carbohydrates that you can take with the medication are things like crackers, fruit, vegetables, granola, oatmeal. It's really just those high protein meals and snacks that you want to separate between the time that you're taking Cinemet. And if we have a Q&A at the end, I can maybe help answer some of your questions about this because sometimes people have more questions about this specific topic. So let's talk about how to prevent and manage constipation. So constipation is one of the most frequent non-motor symptoms associated with Parkinson's disease, which is why I wanted to talk to you guys about it today. Also, nutrition plays a really big role in it. So constipation refers to difficulty passing stool and or a decrease in the number of stools. So it may be that you really have to go to the bathroom and you're sitting there and you're straining and straining, or you're really relying on laxatives or stool softeners, or maybe you're going a day or a few days without having a bowel movement. That's what constipation is. It can cause discomfort such as bloating, cramping, and straining. And then dealing with this discomfort can take a toll on the way someone feels and get in the way of doing the things they enjoy. Something that I've seen a lot with patients who have been dealing with pretty severe constipation is they're relying on laxatives, which are effective, but then they never know when the laxatives are going to hit, so to speak. So then it kind of controls their life because they feel afraid to leave the house because they don't want to have to be at the grocery store or the gym or out in a social setting and have to run and find a bathroom because the laxatives started to work. So dealing with constipation can really just interfere with somebody's overall quality of life. It's not just feeling discomfort and bloating and straining. It really just impacts, just like what I was just saying, it impacts their social life. It makes them afraid to leave the house. And it's a pretty frustrating symptom that people have to experience. So, one of the ways, nutritional ways of managing and really preventing constipation is to incorporate more dietary fiber into your diet. So, dietary fiber plays a crucial role in managing digestive health. And how it does that is it promotes bowel regularity. And when you're having regular bowel movements, you're detoxifying by removing waste from your body. So think about it. Going number two is one of our body's main detoxification pathways, right? It's one of the main ways we excrete waste from our body. So when you're having regular bowel movements, you're regularly excreting waste in your body. So it helps promote detoxification. It also helps promote a balanced microbiome. So probiotics are a pretty big health craze. Eating enough dietary fiber actually helps feed the good bacteria in your gut and create a really balanced microbiome. So you don't necessarily have to take probiotic supplements if you're eating a really healthy diet with adequate fiber. And healthy digestion is key for optimizing your health with Parkinson's. So just like I strongly encouraged you to eat more antioxidants and omega-3 fatty acids, I strongly encourage you to, unless you have some other GI condition where you can't tolerate a lot of fiber, I strongly encourage you to prioritize eating enough fiber in your diet. Like I mentioned with the fluids, fiber intake is one of those things that people often think they're eating enough fiber, but 9 out of 10 times they're not. And adults need roughly around 25 to 30 grams of fiber daily. Um, you don't really have to tediously track the grams of fiber that you're eating, but if you're unsure of whether or not you're eating enough fiber, I kind of do recommend that in the beginning you do track it just to get an idea of how much fiber you're actually eating. Because without tracking it and getting some baseline number of how many grams of fiber you're eating in a day, you really don't know if you're eating enough or not. So just start looking at the nutrition facts labels when you're picking out foods and look at the grams of fiber per serving so you can track it that way. And then adding more fruits and vegetables to your meals each day and whole grains, and maybe looking up, how many grams of fiber are in a cup of brown rice or how many grams of fiber are in an apple. Again, just to get an idea of whether or not you're eating enough fiber to begin with. Once you kind of have that baseline number down and you realize how many grams of fiber you're eating, then you can determine whether you're eating enough or whether you need to add in more. So examples of fiber-rich foods are whole grains like oats, whole wheat, so whole wheat bread, whole wheat flour, whole wheat pasta, brown rice, quinoa, beans and legumes, just like black beans, pinto beans, garbanzo beans, soybeans, dark leafy greens, dried fruits like dates, figs, and prunes, and fresh fruit like apples, pears, and berries. And here's a couple tips on increasing your fiber intake. So switch to whole grains, add more beans to your dishes like soup, salads, burritos. Add vegetables to meals like omelets, salads, soups, snack on vegetables, snack on fruit, make smoothies, make yogurt parfaits. So just like with the antioxidants and omega-3s with the fiber, I kind of want you to think about it the same way. You might not have to drastically change your diet. You're just taking a look at what you're currently eating and figuring out how you can add in more antioxidants, omega-3s, and fiber into those meals. So that's kind of how I designed these tip sheets, was to give you ideas on how you can just add those into the foods you're probably already eating. And another quick case study on constipation to give you guys a real life example of how constipation can be treated with nutrition is my patient Tim. So Tim came to me and he was struggling with ongoing constipation. His constipation was so severe at times that it led to hospitalization. So he actually got so severely constipated, he would have to go to the hospital to get it treated. He depended on taking laxatives and stool softeners, and it was really affecting his ability to do the things he enjoyed, such as exercising. He was tired of taking laxatives because he felt he had to run to the bathroom when he was out and about, and he felt like this issue was taking over his life. So some of the interventions we did with Tim was we made sure he was getting 25 to 30 grams of fiber daily. We switched to whole grain products and increased intakes of fruits, vegetables, added more beans and legumes. We made sure he was adequately hydrated. Hydration and fiber intake go hand in hand. So just make sure that if you're eating a lot of fiber, you're adequately hydrated, because in order for fiber to do its job at alleviating constipation, you need to be adequately hydrated. We added more movement and exercise into his day. So it's great that you guys are already in an exercise program, because movement and exercise is essential to preventing and alleviating constipation. When you exercise and move, it actually helps stimulate the movement in your GI tract as well, making it easier for you to pass stools. We focused on stress reduction and incorporated stress relief techniques, and we included magnesium supplements into his regimen. And as a result, he was having regular bowel movements, less straining, less bloating, no more discomfort, no longer depending on laxatives and stool softeners regularly. He was able to do the things he enjoys, like exercising and going out with friends, and it basically improved his overall quality of life. So just pay attention to how a symptom like the examples I gave you earlier with my client AD and Tim, a symptom like fatigue or constipation can really end up taking control of your life, and it might feel like a new normal, like something you just have to deal with, but you don't. There's solutions for it, and it can totally change the way that you feel once you get a hold of managing those symptoms. And so I wanted to offer you guys a special offer, which is my free guide on preventing and alleviating constipation with Parkinson's disease. So there's a few ways that you can get this free guide. You can either visit this website, which is just right here, bit.ly/nutritionpd. And if you go to that website, you'll get routed to where you can fill out your name and email address, and then you'll get sent my free guide. You can also scan this QR code on the screen. But if you're unable to do either of those two things, then you can just let Jessica know that you're interested in receiving this free guide, and she can provide me with your email and I can send that over to your email. So I'll leave this up for just a second so you have a chance to write it down or scan. But basically, this free guide that I created is a pretty in-depth booklet on how you can prevent and alleviate constipation with nutrition. So it'll give you tips for increasing fiber intake, fluid intake, tips for stress reduction and exercise. And it also has recipes in it as well. And so just to summarize some of the key points from our talk, nutrition plays an important role in managing Parkinson's related symptoms and complications. You can get relief from Parkinson's related symptoms and complications and improve your well-being. I just like to make that point to people. to give you guys hope, to know that some of the symptoms you're experiencing do not have to be your new normal and that there is something that can be done about it. Antioxidants and omega-3 fatty acid rich foods help defend your body's nervous system from damage. Fiber is essential for fiber is essential for a healthy gut, which is key to managing Parkinson's. And focus on simplifying your meal prep and cooking so that it's easier to adhere to a healthy diet. So like I said, just start focusing on those nutrients that you can add into your diet. Don't feel like you have to drastically revamp your diet overnight. Just start incorporating some of those tips that I provided. And then I will exit out of this so that we can do a little Q&A if I think we have a couple minutes. So any supplement that you plan on taking, like let's say you want to take vitamin D, zinc, magnesium, you can always request in your routine blood work from your primary care physician, ask them to check your zinc levels. It's just important to include, like, check your zinc levels, check your vitamin D levels to make sure that they're optimal. You can always ask your primary care physician to include that in your routine blood work. Getting nutrients from food is the safest way to get them because they're not in mega doses, so there's less side effects associated with getting nutrients from food. So you can always eat more zinc-rich foods. I want to say pumpkin seeds are rich in zinc, but I don't know off the top of my head all the foods that are rich in zinc. But you can incorporate more foods that are rich in zinc. And then as far as supplements, just make sure you actually need the supplement. Like I said, check your blood work to see where those levels lie. Because supplements are great, but you don't want to take too much of a good thing if you don't need it. Like, you don't always need to take certain supplements. So you want to make sure that you're not taking dosages that are higher than what you actually need. I think important ones to look at for Parkinson's disease. So zinc, vitamin D, vitamin B12, vitamin B6, magnesium. Those are important. And during routine blood work, they'll already check a lot of the other important things like your electrolytes, your blood sugar, your cholesterol levels, but sometimes they won't include those vitamins that I just mentioned. So you just want to ask them to add those on. DHA is one of the omega-3 fatty acids, and it's one of the primary ones in our brain. And it's found in those omega-3 rich foods that I listed. So like the fatty fish, like salmon, sardines. But when you take a fish oil supplement, it also has DHA in it. So you can get it in supplement form as well. And some fish oil supplements, actually, there's a ratio between, I don't want to get too complicated with this, but the other omega-3 fatty acid is called EPA. But the one for DHA is the primary one for your brain. So when I'm recommending that to people to Parkinson's, I tell them to choose a fish oil that has a higher ratio of DHA to EPA. Because some of them will have a higher ratio of EPA to DHA, which isn't necessarily bad, but for Parkinson's, I think having a higher ratio of DHA is a better option. So just to answer your question, you can get it through diet by eating those omega-3 rich foods, but you can also get it through supplement form by taking a fish oil supplement. Certain yogurts are actually pretty high in protein, so it really just depends on the type of yogurt that you're eating. I would probably say to treat yogurt as one of those protein foods. I wouldn't say to eat it with your levodopa if you're wanting to separate protein intake from levodopa, I would take those two separately. I would treat yogurt as more of a protein food. And honestly, too, if you're eating yogurt as a snack or as a food, I would actually so levodopa aside, let's say you're choosing yogurt at the store to add to your diet, I would say choose a yogurt that has protein in it. Um, it's a good source of protein. A lot of yogurts are really, really high in sugar. Um, so I would say a healthier option is to choose one of those ones that are higher in protein and lower in sugar, but again, still separate it from the time that you're taking the levodopa. But again, you can have the levodopa with carbohydrates, right? So crackers, um, bread, granola, fruit, vegetables, oatmeal. There's other things that you can have with your levodopa that don't contain protein. Kiwi is high in fiber, and I think it really helps with constipation. Yeah, kiwis are great, apples, pears, um, most fruit has fiber, but you're right, some have a higher content than others, and kiwis are a really good source. I don't know if it reduces the antioxidant content. That's not something that I looked into. Um, so I'd have to look that up because I don't really have an answer for whether it reduces the antioxidant content. Dried fruits are high in fiber, so that's a benefit of them, but I would have to look up. That's a good question. Okay.
Um, so we were talking a little bit about supplements, and you know, you mentioned that it's better to get their nutrients from their diet, but let's say that they do want to take a supplement. Supplements are not necessarily regulated.
Yeah.
So how would you recommend that they source quality supplements? Is there like a website that you
Yeah.
would recommend or a brand that you would recommend, or how do they know they're going to get something quality?
Yeah, that's a really good question. And there is a website, and I can actually share it with you. It has to be shared. The website that I use has to be shared by a practitioner. And it's a website that does third-party testing and has quality assurance measures to make sure that the supplements are tested and just make sure that they're not in conditions that denature the supplements and that you're getting what you're actually buying, because Jessica has a really great point. So for those of you that don't know, the supplement industry is not FDA regulated. So because of that, actually, there's a lot of things on the market that sadly aren't what they say they are. Um, and you really want to proceed with caution when you're choosing the supplement brand and the source of where you're buying a supplement. A lot of people buy their supplements from Amazon. I'm guilty. I used to do that in the past because it's really convenient. But on Amazon, there's actually a lot of counterfeits. And some of the supplement brands have actually tested their supplements that were sold on Amazon and found out that they were counterfeits or that they didn't contain the active ingredients in them. So you do want to proceed with caution when you're purchasing supplements from Amazon. There's a website called Full Scripts, and I'll share that with Jessica. It's the one that I just explained that is regulated. Um, so you want to get a brand that's, again, reputable, has third-party testing, and you want to buy it from a reputable dispenser. Someone made a good comparison that you wouldn't really buy your medication on Amazon or buy your medication from some random reseller. You should think of your supplements the same way. You shouldn't buy your supplements from some random reseller. You want to know that it's coming straight from the source and from a trusted source, because you might be taking a supplement thinking that you're doing something good for your body, and it actually might be doing more harm than good. I think the same could be said about taking a supplement that you don't really need. So that's why it's so important to get your nutrients from food and get blood work done. And preferably, if you can work with a provider, if not a dietitian, then a physician or somebody else who's well versed in supplements and get their recommendations and only take supplements that you actually need, right? Because you might be doing more harm than good by taking some random supplement that you don't need. And also, they're really expensive. So you might be spending money on something that you don't actually need.
My dad was asking, um, you know how people have to kind of list all of their medications? Are there certain supplements that they should also be listing to let, either the pharmacist or their doctor kind of know what they're taking?
Yeah, I think so because they're just like how there's a drug nutrient interaction with levodopa and protein, which that interaction isn't that dangerous, luckily, right? It's just maybe the medication won't get absorbed as well. It's not that dangerous of an interaction. But there are some medications, I'm sorry, there are some supplements that can really interfere with the effectiveness of a medication. Um, Mostly with herbal supplements, not so much with vitamins and minerals, but mostly with herbal supplements. There's a lot of drug nutrient interaction. So if you're taking any type of herbs, that's definitely something you'd want to tell your doctor and pharmacist about. Also be careful because a lot of supplements will have like a proprietary blend. Well, so say you get like, I don't know, let's say you get vitamin D or uh, I don't know, a B complex, right? And you'll think, okay, I'm taking a B complex or vitamin D. Look at the ingredients level. Some supplements put proprietary blends of different herbs. And again, if you're taking medication, one of those herbs might be interfering with that. And you're not going to know unless you bring that up to your doctor or pharmacist or research it online to make sure that there's no interaction that could be interfering with your medication. Like a good example is this is like not real. I mean, maybe this is Parkinson's related because depression can be a complication of Parkinson's, but there's an herb called St. John's wort, and it's an herb that's used for depression, and it's actually a wonderful herb. It can be really effective for some people at managing depressive symptoms, but it can't be taken with pharmaceutical antidepressants. So that's just one example of how an herbal supplement, even though it might be effective and good, can interact with a medication that somebody's taking. And also like I told you guys about my patient Tim who was taking who had chronic fatigue and he was taking statin medications for his high blood pressure. So statins are known to deplete CoQ10. And CoQ10 is a very, very important nutrient that's involved in energy production. He'd been taking statins for years and never taking a CoQ10 supplement. So it was kind of like a little bit of a light bulb that went off, like, oh, your CoQ10 levels are probably really low because you've been taking statins for years and you're also experiencing low energy. And we know that CoQ10 helps with energy production. Like, I wonder if there's some kind of connection there, right? Like maybe it wasn't causing all of his fatigue, but it's just interesting to kind of look at things a little bit deeper when you're trying to get to the bottom of some of the symptoms that you're experiencing. Like sometimes it takes really kind of digging into, um, you know, some of the nutrient side effects of medications.
Is CoQ10 one of the ones that they can add to their blood work? Is that something that the
I
doctor can check?
Yeah, I don't know. I feel like CoQ10's not regularly tested. They might be able to. I haven't looked at CoQ10. Yeah, you could ask about it. Honestly, too, I'm the type of patient, I'm the type of patient that asks them to add everything I want to my blood work. And if you have a pretty accommodating doctor or you give them a reason for why you want it added, a lot of the times they'll accommodate to it. So I just try to add on anything that I want to look at. And I just encourage people to do the same because they're going to get the blood work done and it's going to get billed to their insurance anyway. And so you might as well add add something else on. So you don't, okay, so just in case the first question was relevant too, like you don't have to go to your pharmacist, right? And be like, I'm taking such and such and such and such. Like, first of all, don't take a bunch of supplements you don't need. Like I have to just stress that. I used to be one of those people that before I was a dietitian, I wanted to take every supplement that sounded like I needed it, right? Like whatever it sounded like it did, I was like, oh, I need that supplement. And I had a whole thing of supplement, whole cabinet of supplements. Be more conservative with only taking the supplements you need. Research those, right? Like don't just take random supplements, and then let your doctor know what supplements you're taking. And you can tell your pharmacist about, like I said, mostly the herbals. You don't have to worry. Like if you're taking a multivitamin, like that's probably not interacting with anything. And then the other question was like, if I recommend supplements, I do recommend supplements. Usually I recommend that people take a really good multivitamin just to cover their bases. You'll feel more energized. You'll feel better if you take a daily multivitamin. Also, omega-3s for Parkinson's is a supplement that I frequently recommend, just because people typically aren't eating enough of those fatty fish, nuts, and seeds in their diet. So taking an omega-3 and then any other type of vitamins is definitely case by case, just depending on the symptoms that a person is experiencing, their lab work, things like that. But I would say that the two most common supplements that I recommend to everyone with Parkinson's are multivitamins and omega-3s, which are pretty safe. I don't think that there's going to be any interactions or negative side effects associated with those two. That's a great way to ask your doctor. You just say, hey, I've been taking statins for a while, and I know that statins can deplete CoQ10. I'd really like it if you checked my CoQ10 levels. That's a really easy way to ask them that. And then if they say, well, you don't really need that checked, you could just say, well, I'd like it checked anyway because I want to make sure that my levels are low before I consider taking a supplement. And then they'll probably say, okay, we'll add it on.
Well, thank you so much. If there aren't any more questions, we'll let you get back to the rest of your Saturday. Thank you for a very informative
Oh,
talk.
you're welcome.
Um, I definitely learned something. I'm sure everybody else feels the
Mhm.
same. So we appreciate your time.
Thank you
Thank you
so
so much.
much. You're welcome. And like I said, I'll share the slides with Jessica so you guys
Perfect.
have them. And then also, if you're interested in receiving that free guide, just let Jessica know and she'll share your email address with me. And if you're not interested in the free guide, you'll still get added to my email list. That way, when I put out nutrition content, you receive it in your email. All right. Thank you guys. Have a good
Yeah,
Saturday.
thank you.
Bye.